Hi, my name is Paul. I'm a medical student. Do you mind if I ask your name, please?
It's Marie O'Malley.
Marie, how are you getting on, Marie? Could I ask your age, Marie?
I'm 52.
52, okay. Is it alright if I call you Marie, by the way?
Yeah, that's perfect.
Right.
Yes.
So, Marie, how can I help you today?
To be honest, I'm kind of sorry for bothering you, doctor, but I have this bit of a cough for the last few weeks, so I decided to come and find out what's causing it, you know.
Okay, and
Yeah.
you're saying for the last few weeks. How long has the cough actually been going on?
I suppose about 3 weeks.
About 3 weeks?
Yes.
Okay. And if I was to ask you to describe the cough, how could you describe it?
I suppose it's kind of like a chesty cough.
Chesty
Yeah,
cough.
yeah.
And are you finding that are you coughing up anything?
Yes, I'm coughing up phlegm.
You're coughing up phlegm.
Yeah.
And is there any particular colour to the phlegm?
It's kind of green phlegm.
It's a green phlegm.
Yeah,
Okay.
yeah.
And have you noticed, like how much actually of the phlegm are you coughing up per day?
Oh, well, I never really kind of took that much notice, but you know, sometimes I would bring it up and sometimes I wouldn't. So I suppose it'd be like maybe a teaspoon each time.
Okay.
Yeah.
Right. Very good. And have you at any stage coughed up any blood?
No.
No, there's been no blood.
No.
Okay. And just in relation to the cough as well, have you noticed any other associated symptoms? Are you getting any kind of chest pain?
No.
No chest pain.
No.
Any shortness of breath?
No.
No. Have you found at any time that you feel wheezy?
No.
No wheeze. And is there anything else that you're actually experiencing as well as the cough?
No, it's mainly the cough really and the phlegm, and it's just that it's very annoying
Yeah.
because I'm coughing during the night time and I'm coughing during the day, and to be honest, I'm keeping my husband awake. And he has sent me into the surgery today because he said he's sick. He said he's getting no sleep with me.
Okay.
You know, I'm not getting much sleep either, I suppose.
Yeah, I can see how that can be actually
Yeah.
quite concerning. So
Yeah.
we'll try to get down to what's actually causing it. Like, so
Great.
you were saying about the timing as well. Is there any particular time of day that's worse? Is it nighttime worse or is the morning worse?
Well, the morning I would cough always, you know, probably worse when I'd wake up, you know, because the old phlegm might have built up during the night. But even during the night I'm coughing. So then during the day I'm coughing. So so the morning probably is the worst time.
Okay.
Yeah.
Okay. And just to move on, have you noticed any weight loss recently that you haven't, unintentional weight loss?
No.
And any kind of decrease in your appetite?
No.
Have you vomited at any stage?
No.
Do you smoke, do you mind me asking?
I do, yes.
You do. How much would you smoke?
10
10.
cigarettes a day.
Okay. And how long have you been smoking, roughly?
Gosh, I suppose I've been smoking since I was 16.
Okay.
Yeah. I've never smoked any more than 10. I've always kept it to 10, you know.
Okay.
Yeah.
That's grand. And just, do you ever experience any kind of night sweats?
No.
No night sweats.
No.
And have you ever at any stage been in contact with someone that has TB?
No.
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 That's okay.
No.
And like, what do you think yourself actually might be causing this?
I don't know. Maybe it's some sort of a chest infection or something. You know,
Okay.
the fact that it's kind of a chesty cough.
Yeah.
Yeah.
Mm-hmm. And just to kind of go on as well, have you are you on any medications at the moment?
I am, yes.
Yeah. What medications are you on?
I have to think now. Ramipril. It's
Oh,
for
yeah.
my blood pressure. I have high blood pressure.
Okay. And when did you start that?
It would be, I suppose, about 4 years ago.
About 4 years
Yeah,
ago.
yeah,
Okay.
yeah.
Yeah, very good. And just to we're moving on to like social history. I asked you about like smoking already. Do you drink?
I would, not a lot. Maybe one night at the weekend on a Saturday night.
And what do you actually work as?
I'm a legal secretary.
Legal secretary.
Yeah.
And do you have much stress in your life at the moment?
No.
Okay. And is there any kind of family history of any kind of respiratory problems, or is there anything that you like, any kind of cancers or anything that's run in the family?
Well, actually, I suppose that's really what's at the back of my mind is that my dad actually died of lung cancer.
Mm-hmm.
You know, and he was a smoker. So I suppose even though I don't feel that sick or anything, you know, it's still there.
Yeah.
Yeah.
I can see
Yeah.
that, like, why that would be kind of
Yeah.
concerning.
Yeah.
But we'll try to get down to the real nitty gritty of what's behind it.
Yeah.
But like, obviously the smoking, if what I tell you, even if it wasn't to do with that, you should stop smoking as well. It's just for your own health.
I know what you're saying, doctor. And my husband and my kids are at me all the time. But then I think I'm only smoking 10. Do you know, I never go beyond the 10.
Mhm.
Um,
Yeah, that's okay. Just to kind of go over, so just kind of summarise what you've said to me, just to see if
Okay,
I'm
doctor. Yeah,
taking it all in right.
yeah.
So about 3 weeks ago, you started developing a cough,
Yes.
and it's a kind of productive cough. So like, as in you're coughing up some phlegm.
Yes. Yes.
It's a yellowy or green phlegm,
Yeah,
isn't it?
Yeah. Yeah.
Okay. There's been no blood.
No.
No blood. Okay. You smoke roughly around 10 cigarettes a day,
Yes.
and that's you've been doing that for quite a while.
Yes.
And you're just a bit concerned. Like, have you had any cough or any fever recently?
No.
No fever.
No fever with this cough. No.
Yeah.
No.
Okay. So, what I want to do no, actually, is there anything I've left out of that you can think?
No, I don't think so, doctor.
Okay.
No.
So, what I want to do now is I would like to do an examination, if that would be okay with you. So I just want to have a listen to your chest,
Okay.
and
okay.
we're going to move on to just having an exam as well of just your feel your stomach and listen to your heart. Does that sound okay?
Okay, yeah, that sounds good, doctor. Yeah.
Okay.
No problem.
Okay, Mary, after doing the exam on you, and from what you've told me when I was kind of talking to you earlier,
Yes.
I think that this could be caused by a few different things. So
Okay.
what I'd like to do is I'd like to take bloods today. And
Okay.
do you know the way that you said you've been coughing up some phlegm? So
Yes.
like, if we could possibly get some some of that phlegm as well, I'd like to send that off just to kind of culture it, to see if there's anything that's behind it.
Okay.
So
And what would the blood test be for? Why do you want to take blood samples?
it's just looking for any kind of infection.
Right.
So I just want to rule out certain things, like, so
Okay.
for instance, there could be a possible pneumonia as well that could be causing this.
Right. Okay.
But also we want to look into the likes of, I'd like to do what's called spirometry, and also do peak flow, because because of your smoking history,
Yes.
what I want to see if there's a possibility that you could have a thing called chronic obstructive pulmonary disease, which is what
Sounds very serious, doctor.
it's just what can happen to people that have been smoking for quite a while.
Okay.
So basically, by doing those tests, we can see if your lungs have been affected by smoking.
Okay.
Yeah.
Okay.
And the other thing then, obviously, just like, it'd be good as well if we could probably then, based on those results, we could see then if we need to send you off also to a bit of a chest X-ray as well.
Okay.
So,
Okay. That's what I was wondering. Actually, that
Yeah.
was one of the questions in my head. Would I need a chest X-ray to
Yeah,
show if there's any problems there?
yeah. I think it could be for the best as well. So it'll help. It'll help. The way you have a few doubts in your mind, what could be causing this.
Yeah.
It'll just help actually to alleviate those doubts,
Okay.
and
Yeah.
like, we can go on then to once we find what's the cause of why you're getting this cough, we can go off and then try to deal with it and give you treatment for it.
Okay.
Yeah. Does that sound okay?
Sounds okay. So I wouldn't actually get anything today. You wouldn't put me on anything straight away for it.
Well, the best thing at the moment is, like, for the cough, is just, I suppose, if you want to take some sort of cough medicine, it might help, because you said you're getting kind of at night time is quite a nuisance as well.
Yeah.
And generally coughs can take, like, if it's because of your smoking, the best thing for you to do is to stop the smoking, really. Yeah.
I know.
Yeah.
It will be hard. I know I only smoke 10 cigarettes, but I do love those 10 cigarettes.
I know. But what we could do is actually maybe I could give you we could give you a nicotine replacement.
Okay.
So you could still get, the way you get those cravings for the cigarettes? If we gave you maybe a patch, like the those sort of things can help you actually, you still get the nicotine, so you'll be able to...
So I wouldn't have the craving.
You won't have the craving as much, yeah.
Okay.
So, is there any kind of questions you have?
Well, no, I suppose I'm delighted. No, it makes sense. Everything that you've told me makes sense. And no, I did try a cough bottle. I tried Exquitex, and it didn't seem to work for me. So, what cough bottle would be the best cough bottle to go on, do you think?
I was going to say Exquitex probably. Actually, would be
maybe I didn't take it for long enough or something.
Yeah. Well, cough medicines they can just be helpful to just kind of relax, so it's not irritating your throat as much.
I suppose I was afraid to stay on it too long, really.
Yeah.
Do you know? Yeah. It'll be okay to go back on that again anyway.
Yeah, just for the meanwhile, until we find out exactly what's behind it.
Great. Thanks, Doctor. That's great. You're very good. Thank you.
So thanks, Paul, for that. I think you took that history very well of our patient there today. I'm just going to go through a few things with you about how you performed in that history. Taking the history itself, you were very good. I mean, you hit all the main bases. You asked her about her presenting complaint. You moved through her recent medical history. You elicited the fact that she was on medication, and you spoke about her social history and her family history. So that was great. You kind of moved through that very well. And in terms of your communication with her and your professionalism, that was very good. So you started off by asking her permission to call her by her first name, which is very courteous, and it's always good to kind of establish that rapport earlier on. So that was excellent. And I could see that you were kind of moving through your list of differentials there, thinking about the different things and asking questions appropriately about things like risk factors for tuberculosis exposure and red flags, things that might suggest that there's some kind of malignancy going on. Just one or two things just to remember in your future histories or any other patients that you might be seeing later on is just to try and keep your questions as broad and as open as possible early on. So rather than jumping in and coming down on does she have chest pain, does she have the wheeze, just to try and ask more open-ended questions. You might get more information out of the patient. And particularly, I think you spotted it near the end, this lady was particularly concerned about some kind of a cancer going on. Her father had died from cancer at a young age, and I think that was really one of the kind of the key things that brought her in. So if you give the patient a little bit of time at the beginning, sometimes those things come out much earlier, and you can address them much earlier with them or with the patient. But despite that, you gave her very good reassurance during the history, that a cure, that you would get to the bottom of what was going on. So I think that was very good. So really, again, just thinking about the prevention thing that came up very well, also during the history. Just thinking about trying to advise and counsel patients about smoking cessation, things like that. Sometimes it's good to get them involved and see what's stopping them from stopping at the moment. What other ways you can help, and you did that as well near the end. You were offering the nicotine replacement therapy, so that was very useful also. In terms of thinking about other differentials during your history taking, there were one or two things that I thought you could have hit on a little more. So you're obviously thinking about the malignancy, the infection. There are other sources of infection other than the chest alone, which could cause some of her symptoms. Things like very upper respiratory kind of sinus type things, possibly GI reflux. Gastroesophageal reflux disease could be a cause of cough as well. So just to think about some of those other broader non-respiratory causes of cough, and obviously if she had any kind of history of atopy, eczema, sinusitis, asthma, anything like that in the past, it would be important just to hit on those other causes of cough. So it might be good for you just to go back and have a look at some of those causes again in your revision after today.
Okay.
So that would be the main action point that I would look at, just keeping your questions as open as possible, trying to get the patient involved in the prevention counselling, and then just look at some of the broader list of differentials for cough. So to move on to your management then, we'll just talk about management for a second. So I suppose here at this point, can you just give me your top list of differentials, your top 3 or 4?
So like my top few would be upper respiratory tract infection. It is going on for quite a while, so that's why I possibly might think that it could be something else. It could be a COPD exacerbation. It's because of the 3 weeks as well. It's in between. It's getting more towards chronic after 3 weeks. I think there is a possibility of pneumonia, and because of her smoking history, you do want to rule out malignancy as well.
Yeah. Okay.
So, and then also another possibility as well, because of she was coughing up yellow mucus and also having a cough. You'd also want to look into the likes of asthma, so to do like the spirometry, and in that way you can see if it's a COPD or if it could be an asthma cause as well. So also put in peak flow.
Yeah. So your investigations and your exam obviously would have helped you kind of ascertain if there was any other signs there that would suggest some of those things. So. So, you know, with this being kind of a general practice setting, and the fact that this lady, you know, she's been unwell now for 3 weeks, you mentioned bloods. Is that something you think we'd necessarily jump into straight away, or can you tell me a little bit more about why you were planning on doing the bloods?
Just for general health as well. It's always good when the patient comes in a practice to do bloods, especially a lady of her age as well. Because there might be the signs of infection. You can check for the white cells or any kind of inflammatory markers as well that might be there.
Right.
And then by going on to doing the sputum culture, you can check if there's any cause behind it, like your pneumonia causes, and then various other things that you can send them off. Like obviously we'd have to send them off for chest X-ray to the hospital. Yeah.
But, Okay. So I mean, bloods, we do often do them here in primary care. Maybe not as often as they might be done in the hospital setting. It's just always good to know if you're going to send them from here, just to have a very clear reason for knowing why you're doing them. So you're able to, you know, justify why you're going to do them. So that's good. But rather than doing them in a kind of you know, you don't want to be just sending them off for no reason whatsoever. The chest X-ray, definitely. Is there anything else you'd like to ask her before you'd send her for a chest X-ray, or anything else you'd just like to check? So a 42-year-old lady.
Oh, if she's pregnant,
Yeah, so
possibility of pregnancy.
Yeah, so you just want to just make sure, just kind of safety around all of these investigations as well.
Okay.
So, and what would your plan be now, just following up with her today? So you're kind of going to order these investigations. How are you going to follow up on her from here?
Well, so what I like to do, and I'll actually make sure, is that the patient comes back in, so that I'll have arranged that she comes back for maybe in about a week's time or 2 weeks' time, when we have the results all of all the tests that we've done and the X-ray. From there, I'd like to make progress on cutting out smoking, because no matter what, that's not good for our health. So hopefully we'll have made strides in that. As regards the cause of the cough, an ACE inhibitor can be a cause of a cough, so we also have to rule out, could that be a cause? We'll want to, if it's like a COPD, we'll want to start her on medications. So we can be putting on her a long-acting beta agonist and a long-acting muscarinic. We could, if it was asthma, put her on the asthmatic treatment as well. So
and then for your top differential, the first thing you think it is?
The first thing that I think it is, I at the moment I think it's a COPD exacerbation. So or it's going to be an upper respiratory tract infection. Okay, and how will you treat that? Upper respiratory tract infection. The best thing to do with that is to basically tell the patient that it could take up to 6 weeks for the cough to actually go altogether, and that basically if she needs any sort of pain medication, she can take some paracetamol, and just for irritation of the lining, she possibly could take some cough medicine, but that's not of little benefit really. But it's just sometimes can help the patients because they know they're taking something for the cough. Okay. So yeah. Okay, that's great. Thanks. Okay, no problem.